Have you ever heard of a medical condition so rare and bizarre that it leaves you questioning the very fabric of human health? There is one such condition, and it's not just a curiosity, it's a haunting reminder of how interconnected our bodies and cultures can be. In this video, we'll dive deep into the world of this medical condition, a neurodegenerative disease that was once prevalent among the Fore people of Papua New Guinea. You might be wondering what exactly causes this strange illness and how does it relate to cannibalistic practices. As we explore, you can expect to learn about its symptoms, the science behind its transmission, and the cultural practices that contributed to its spread. We'll also discuss the broader implications of this rare medical condition, including how it highlights the importance of understanding rare diseases and their impact on communities. Understanding rare medical conditions is crucial not only for medical professionals but for society as a whole. Rare diseases can often be overlooked, yet they can have devastating effects on individuals and their families. By shedding light on these medical conditions, we aim to raise awareness about the significance of studying these unusual medical conditions and the lessons they can teach us about health, culture, and the human experience. So, stick around as we unravel the mysteries of this medical condition and its lasting legacy. Symptoms of Kuru. Kuru is a devastating neurological disorder that manifests through a range of alarming symptoms. One of the earliest signs is the presence of tremors, which can affect various parts of the body, making simple tasks increasingly difficult. As the disease progresses, individuals often experience a significant loss of coordination, leading to unsteady movements and an inability to walk without assistance. Emotional instability is another hallmark of Kuru, with affected individuals displaying sudden mood swings, uncontrollable laughter, or inappropriate emotional responses, which can be distressing for both the patient and their loved ones. As time goes on, these symptoms worsen, leading to severe physical and mental decline. Patients may become unable to perform basic daily activities, and the disease can ultimately result in complete loss of mobility and cognitive function. The progression of Kuru is relentless, often culminating in death within a few years of symptom onset. Kuru primarily affected the Fore people of Papua New Guinea, particularly during the mid-20th century when cannibalistic practices were more common. This demographic was particularly vulnerable due to their cultural traditions, which involved consuming the brains of deceased relatives as a sign of respect. Understanding the symptoms and progression of Kuru is crucial, not only for historical context, but also for recognizing the broader implications of rare diseases and their impact on specific communities. By learning about Kuru, we can appreciate the importance of cultural practices in health and disease transmission. Impact and prevalence. Kuru, once a significant health crisis, has seen a dramatic decline in reported cases over the years. At its peak in the 1950s and 1960s, Kuru affected hundreds of individuals annually, with estimates suggesting that around 1,000 cases were reported during the height of the epidemic. However, in recent years, the number of new cases has dwindled significantly, with only a handful of cases documented each year, primarily due to the cessation of cannibalistic practices among the Fore people of Papua New Guinea. Geographically, Kuru was concentrated among specific tribes in the eastern highlands of Papua New Guinea, particularly the Fore tribe, where cultural traditions included the ritualistic consumption of deceased relatives. This practice was deeply rooted in their beliefs about honoring the dead, but it inadvertently facilitated the spread of the prion responsible for Kuru. The historical context of Kuru is essential to understanding its decline. As awareness of the disease grew and the dangers of cannibalism became evident, cultural shifts began to take place. Educational efforts and public health initiatives led to a significant reduction in the practice, effectively curbing the transmission of Kuru. Today, while the disease is largely considered a relic of the past, its impact on the Fore community and the lessons learned about prion diseases continue to resonate in discussions about rare diseases and cultural practices. Fatality rate and prognosis. Kuru is notorious for its exceptionally high fatality rate, with nearly all diagnosed individuals succumbing to the disease within a few years of onset. Historically, the average lifespan post-diagnosis has been reported to be around 12 to 18 months, although some cases have shown a more rapid decline. The progression of Kuru is relentless. As neurological symptoms worsen, patients experience severe physical and cognitive impairments, ultimately leading to death. The disease's trajectory is marked by a gradual deterioration of motor skills, loss of coordination, and profound emotional instability, culminating in a complete inability to care for oneself. The inevitable outcome of Kuru underscores the critical need for awareness and prevention, particularly in communities that have been historically affected. While the number of new cases has significantly decreased due to cultural changes, the legacy of Kuru serves as a stark reminder of the consequences of certain practices. Educating communities about the dangers of prion diseases and promoting alternative methods of honoring deceased loved ones is essential to prevent any resurgence of Kuru or similar conditions. Raising awareness about Kuru is not just about understanding a rare disease, it is about empowering communities to make informed choices that protect their health. By fostering a culture of prevention and education, we can ensure that the tragic history of Kuru does not repeat itself, allowing future generations to thrive without the shadow of this devastating illness. Treatment and cure options. Currently, there is no effective treatment or cure for Kuru, as it is a prion disease that leads to irreversible neurological damage. Once symptoms appear, the focus shifts to supportive care, which aims to improve the quality of life for affected individuals. This may include physical therapy to help maintain mobility, occupational therapy to assist with daily activities, and psychological support to address emotional instability. While these interventions can provide some relief, they do not halt the progression of the disease or reverse its effects. Given the lack of medical treatments, prevention remains the most effective strategy against Kuru. Education plays a crucial role in this effort, particularly in communities where the disease was historically prevalent. By raising awareness about the dangers of cannibalistic practices and the transmission of prion diseases, communities can make informed decisions that protect their health. Cultural change is essential. Promoting alternative ways to honor deceased loved ones can help eliminate the risk of Kuru re-emerging. In summary, while there are no curative options for Kuru, supportive care can help manage symptoms and improve the quality of life for those affected. The emphasis on prevention through education and cultural transformation is vital in ensuring that future generations are safeguarded from this devastating disease. By fostering a deeper understanding of Kuru and its implications, we can work towards a healthier future for communities once impacted by this tragic condition. Kuru. In this video, we've explored the complex and haunting world of Kuru, a rare and devastating neurological disease. We discussed the key symptoms associated with Kuru, including tremors, loss of coordination, and emotional instability, which progressively lead to severe physical and mental decline. The impact of Kuru has been profound, particularly among the Fore people of Papua New Guinea, where cultural practices contributed to its spread. Unfortunately, there is currently no effective treatment or cure for Kuru, making prevention through education and cultural change essential. Understanding rare diseases like Kuru is crucial, not only for historical context, but also for recognizing the broader implications they have on communities and public health. By raising awareness, we can empower individuals and communities to make informed choices that protect their health and well-being. If you found this information valuable, we encourage you to subscribe to our channel for more informative content on rare diseases and health topics. Don't forget to like this video and share it with others who may benefit from learning about Kuru and its implications. Together, we can foster a greater understanding of these critical issues and work towards a healthier future for all. Thank you for joining us on this journey to uncover the mysteries of Kuru, and we look forward to bringing you more enlightening discussions in the future.